a single drop of blood. What if I told you we could detect cancer in just a single drop of blood? Your father died from lung cancer. One drop of blood, if you could have it. Your grandmother died from ovarian cancer. One drop of blood, if you could have it. Currently, each year worldwide, 40 million people are diagnosed with cancer, of which the majority has a stage 4, widely spread, and untreatable tumor. These numbers are, unfortunately, still increasing. Screening of blood on a regular basis can make the difference between life and death, treatable stage 1 and untreatable stage 4 cancer. I'm a medical student and PhD student affiliated with the VU University Medical Center in Amsterdam. We believe that by a simple blood test, we could make enormous strides in the treatment of cancer. What drives me is that we are currently in reach of a blood-based test for detecting any type of cancer in blood. In 1971, President Nixon of the United States declared the symbolic war on cancer. By raising research funds, he initially aimed at a cure for this devastating disease. Till today, we didn't make it to cure all types of cancer, even not with our current arsenal of treatment options, which includes surgical removal, chemotherapy, radiotherapy, and a recently introduced immunotherapy. Still, it doesn't do what we want it to do. It seems that Nixon's Plan A, hit these tumors as hard as you can, fail. Obviously, tumors hide like phantoms or ghosts, small peanut-sized clumps of cells somewhere in your body. They are in development towards a large and widely spread tumor. Early detection of such a clump of cells, while this tumor is not extensively spread yet, would simplify treatment significantly. So how can we find these tumors and these phantoms early? There are several screening programs currently launched that look for traces of cancer. For example, mammography and a stool test. These tests can pinpoint individuals who do have cancer, but they are also hampered by use limitations. Since, on the other side, these tests can also identify people as potential cancer patients while they don't have cancer, causing fear. Or, on the other hand, miss individuals who do have cancer. So how can we improve this early detection of cancer? We know for decades that blood contains molecules derived from a tumor. A well-known example here is PSA, increased in elderly men with prostate cancer. In addition, we know that the blood contains genetic information released by a tumor. And even entire tumor cells can be found in the circulation of cancer patients. These molecules can already be identified when a tumor is not visible for the human eye, on MRI, for example. We in the lab in Amsterdam can read these changes in blood by reading molecules in blood platelets. Blood platelets are small, tiny fragments in our bloodstream that quickly respond to any event, inflammation, or injury in the body. Like an ambulance that is rushing down the street to an injured patient. Imagine you have a small cut in your arm. Platelets immediately respond, activate, stop the bleeding, and initiate generation of a blood scab. Here, our platelets, the ambulances, are the good guys for the body. However, when a tumor appears, this tumor starts to hijack our platelets. And it starts to dictate where these ambulances will go and what work they will do. The platelets start to work for the tumor. We can read these changes in the platelet, and in this way see that the phantom is present somewhere and where it is hiding. This can all be found in blood. Indeed, the tools for early detection of cancer in blood are there. We can detect cancer in an early stage using blood. A renowned cancer researcher, Bert Vogelstein, recently concluded that Nixon's Plan A, hit the tumor as hard as you can, has to be replaced by Plan B. Catch the cancer early, when it can be cured, actually like a spy. Of course, we need to use blood to detect these cancers early, when they can be treated. In this way, we can induce a stage shift at what moment and what point tumors are being detected, from late till early, stage 4 to stage 1, and untreatable to treatable. This is considered to be the holy grail for cancer. A screening program for cancer in blood is within reach. We can detect any cancer in any organ. So instead of organ-by-organ tests, we are currently doing, like the mammography and the stool test, blood does it all in one. We can treat the majority of cancer patients, but only when they are diagnosed in a stage 1 or 2 tumor. Drawing a vial of blood, maybe twice a year, just you may visit a dentist twice a year, will be the future for cancer screening. Can you imagine what such a screening program worldwide, what an impact that would have? Can you imagine what an impact that would have for you and your own family? This also raises ethical questions. Do we want to know that a phantom is hidden somewhere in your body? Do we want to continuously be aware of the fact that cancer can be present? For me personally, yes, I would like to know, since with the fact that the chance that I will develop cancer is reasonably high, given the statistics that 1 out of 3 people will develop cancer once in their life, I would like to know that a treatable tumor is hidden. This increases my chances of survival significantly. For my friends and relatives, yes, I feel the same. We lose too many of our precious loved ones because of this devastating disease. And finally, for society, yes, treatment of a stage 1 breast cancer is $50,000 less expensive than a stage 4 breast cancer, reducing the ever-increasing and increasing costs of healthcare. Using blood, we will have a new way to diagnose cancer. We have to find these phantoms early and then stop them. It comes all down to this. We have to approach cancer from a different side. Be smarter than a tumor. And that can all be found in blood. Thank you.